Which lab department processes a bilirubin test? A. Microbiology. B. Hematology. C. Chemistry. D. Immunology. Answer: C. Bilirubin is a blood chemistry test processed in the clinical chemistry department. When drawing blood cultures, what is done first? A. Apply tourniquet. B. Clean with povidone iodine. C. Insert the needle. D. Label the bottle. Answer: B. Blood cultures require strict aseptic technique. Disinfect the site first to avoid contamination. Why must a tourniquet not stay on over 1 minute? A. It causes bruising. B. It increases hemoconcentration. C. It prevents clotting. D. It causes hemolysis. Answer: B. Prolonged tourniquet application concentrates blood components, altering test results. Which test is most affected by hemolysis? A. Point. B. CBC. C. Potassium. D. Glucose. Answer: C. Potassium is released from red blood cells when lysed, falsely elevating levels. Which specimen must be chilled immediately? A. Glucose. B. Lactate. C. ESR. D. Hemoglobin. Answer: B. Lactate levels degrade quickly and require chilling to preserve accuracy. What is the function of sodium citrate in light blue tubes? A. Clot activator. B. Bacteriostatic. C. Chelates calcium. D. Prevents glycolysis. Answer: C. Sodium citrate binds calcium to prevent clotting, essential for coagulation studies. Which tube should be drawn first in the order of draw? A. Blood culture. B. Lavender. C. Green. D. Gray. Answer: A. Blood cultures are collected first to prevent contamination from other tubes. Which lab test requires protection from light? A. TSH. B. Ammonia. C. Bilirubin. D. Glucose. Answer: C. Bilirubin is photosensitive and must be protected from light to prevent breakdown. A lavender top tube is rejected due to clots. What went wrong? A. Tube expired. B. Tube was overfilled. C. Wrong tube used. D. Not mixed properly. Answer: D. EDTA tubes must be inverted 8 to 10 times to prevent clotting. What is the maximum angle for a venipuncture needle insertion? A. 5 degrees. B. 15 degrees. C. 30 degrees. D. 45 degrees. Answer: C. The needle should be inserted at 15 to 30 degrees to access the vein safely and effectively. Which additive in the green top tube prevents blood clotting by inhibiting thrombin formation? A. Sodium citrate. B. EDTA. C. Heparin. D. Potassium oxalate. Answer: C. Heparin works by inhibiting thrombin and other clotting factors, preventing coagulation. It is used in green top tubes for plasma tests. Why must a lavender top tube be gently inverted after collection? A. To initiate clotting. B. To prevent clot formation. C. To separate plasma. D. To increase cell viability. Answer: B. Gentle inversion mixes the EDTA with blood to prevent clotting. Shaking can cause hemolysis. A patient reports feeling faint during a draw. What is your first response? A. Continue quickly. B. Remove the needle immediately. C. Tilt their head down. D. Offer cold water. Answer B. The draw must be stopped immediately for patient safety. Needle removal is the priority. What is the most critical step in phlebotomy to avoid legal liability? A. Applying the tourniquet. B. Collecting from the correct vein. C. Identifying the patient. D. Choosing the correct gauge. Answer C. Misidentification is the #1 cause of errors. Proper ID prevents serious consequences. Which tube color is used for lead level testing? A. Red. B. Royal blue. C. Yellow. D. Green. Answer B. Royal blue top tubes are trace element free and used for toxicology and heavy metal analysis like lead. Which of the following can falsely elevate potassium results? A. Underfilling a citrate tube. B. Drawing above and foresight. C. Hemolysis during venipuncture. D. Leaving the tourniquet for 10 seconds. Answer C. Hemolysis releases intracellular potassium, falsely increasing results. What gauge needle is typically used for standard adult venipuncture? A. 21. B. 16. C. 30. D. 23. Answer A. A 21 gauge needle is the standard for adult blood draws, balancing flow and comfort. Which lab department would analyze a lavender top tube? A. Chemistry. B. Coagulation. C. Microbiology. D. Hematology. Answer D. Lavender top tubes contain EDTA, which preserves blood cells for hematological testing. What is the primary risk of using an expired collection tube? A. Increased bleeding. B. Inaccurate results. C. Needle contamination. D. Faster hemolysis. Answer B. Expired tubes may not contain effective additives, leading to clotting or compromised sample integrity. During capillary collection, why is the first drop of blood wiped away? A. It contains tissue fluid. B. It is highly oxygenated. C. It is rich in WBCs. D. It is not sterile. Answer A. The first drop is contaminated with interstitial fluid, which can dilute test results. What is the primary risk of drawing blood from the basilic vein? A. Patient fainting. B. Hemoconcentration. C. Nerve or arterial puncture. D. Prolonged bleeding. Answer C. The basilic vein is close to major arteries and the median nerve, increasing the risk of serious complications if punctured. Which specimen is most affected by hemolysis? A. Cholesterol. B. Potassium. C. Glucose. D. Sodium. Answer B. Hemolysis releases intracellular potassium, falsely elevating its levels in lab results. What is the first tube to be filled when using a butterfly and blood culture is not ordered? A. Red. B. Green. C. Lavender. D. Light blue. Answer D. A discard tube, often light blue, is needed to avoid underfilling due to air in the butterfly tubing. Capillary blood most closely resembles which type? A. Venous. B. Arterial. C. Serum. D. Plasma. Answer B. Capillary samples are a mix of arterial, venous, and interstitial fluid but are most similar to arterial blood in composition. What is the additive in a pink top tube? A. EDTA. B. Heparin. C. Sodium citrate. D. SPS. Answer A. Pink top tubes contain EDTA and are commonly used for blood bank testing. Which is a potential complication of excessive tourniquet time? A. Hemoconcentration. B. Microclotting. C. Hypoglycemia. D. Lipemia. Answer A. Prolonged tourniquet application can concentrate blood components due to plasma seeping out of the vein. After drawing blood, which step ensures proper mixing of additives? A. Shaking the tube vigorously. B. Inverting the tube gently 5 to 10 times. C. Placing the tube on ice. D. Letting it sit upright for 30 minutes. Answer B. Proper inversion ensures additives mix thoroughly without damaging cells. Which condition requires fasting for accurate test results? A. CBC. B. Electrolytes. C. Glucose tolerance test. D. Thyroid panel. Answer C. Fasting ensures baseline glucose levels are accurate for interpretation. A lavender top tube is primarily used for which test? A. Point/INR. B. Electrolytes. C. Complete blood count. D. Glucose. Answer C. Lavender tubes contain EDTA, ideal for preserving cell morphology for CBC. Which of the following requires chain of custody documentation? A. Glucose testing. B. Drug screening. C. Lipid profile. D. Hemoglobin A1C. Answer B. Drug tests must be traceable from collection to reporting to maintain legal integrity. Which needle gauge is most commonly used for adult venipuncture? A. 21. B. 18. C. 16. D. 25. Answer A. A 21 gauge needle is standard for most adult blood draws, balancing comfort and blood flow. When performing a heel stick on an infant, which area is appropriate? A. Arch of the foot. B. Center of the heel. C. Top of the foot. D. Medial or lateral plantar surface. Answer D. The medial or lateral plantar surface avoids bone and nerve damage. What action should a phlebotomist take after a needle stick injury? A. Wash hands and ignore. B. File an insurance claim. C. Report incident and follow exposure protocol. D. Disinfect the area and continue working. Answer C. Reporting and following exposure protocols helps prevent disease transmission and ensures safety. Why is the order of draw important? A. To prevent additive cross-contamination. B. To fill tubes evenly. C. To reduce wait time. D. To collect enough blood. Answer A. Additive carryover can alter test results if tubes are drawn in the wrong sequence. A test requiring a cold chain during transport should be placed where? A. On a heat block. B. In a warm box. C. On crushed ice slurry. D. At room temperature. Answer C. Specimens like ammonia must be kept cold to prevent degradation. What should be checked before performing a venipuncture? A. Patient's hair color. B. Test request only. C. Lab coat cleanliness. D. Patient identification and test requisition. Answer D. Verifying identity and order accuracy is critical to patient safety and correct testing. A patient with difficult veins may benefit most from which device? A. Syringe. B. Butterfly needle. C. Straight needle. D. 14-gauge needle. Answer B. Butterfly needles offer better control and are ideal for small or fragile veins. Which lab department processes a basic metabolic panel? A. Hematology. B. Microbiology. C. Chemistry. D. Blood bank. Answer C. The chemistry department handles tests like electrolytes and glucose levels. What color tube is used for a prothrombin time test? A. Red. B. Light blue. C. Lavender. D. Green. Answer B. Light blue tubes contain sodium citrate, required for coagulation studies. Which of the following is a pre-analytical error? A. Mislabeling specimen. B. Wrong centrifuge speed. C. Incorrect analysis method. D. Transcription error in reporting. Answer A. Pre-analytical errors occur before testing, and labeling issues are a leading cause of test rejection.